and welcome. Welcome to Diverse Conversations. This is Ashka Patel. Thank you very much for joining me yet again for another interesting, intriguing, and innovative episode focused on exploring the Canadian pharmacy innovation space. Today, it gives me great pleasure to introduce none other than Ashwin Juneja. Ashwin is a pharmacist and an innovator who has completed his Bachelor's of Science in Pharmacy in 2007 and in his PharmD in 2021, both from the University of Toronto, and his MBA from the Queen's University in 2015. He has spent his career pushing for deeper pharmacist involvement in patient care, including over 11 years as a pharmacy manager. He has most recently been working to help champion innovative approaches within pharmacy through various panels, presentations, and published writing engagements on innovative approaches and technologies, including pharmacogenetics. He's currently the clinical affairs lead at Inagene Diagnostics Inc., and it gives me a great pleasure to have Ashwin join us in this conversation, where we'll be diving a little bit into the topics of the business of pharmacy, pharmacogenetics, and just what the future of pharmacy holds on these topics. And with that, it's a pleasure to introduce Ashwin. All right, welcome back. And now we have Ashwin joining us. Ashwin, welcome to Diverse Conversations, and thank you so much for giving us your time. And I'm sure that the insights that we're going to unpack with this conversation are really going to keep us thinking for the next little while. With that, Ashwin, I welcome you here, and I would love to hear a bit more about your journey in terms of, from being a pharmacist to where you are today. I think it has been admirable, and I would love to hear how you managed to carve that path for yourself.
Yeah, absolutely. First of all, thank you for having me, Ashka. I'm very honored. I've seen some of the guests you've had on this show, and yeah, it's quite the group of individuals that have been featured. So I'm very honored to be here. I guess my path, I don't know if it's been typical, and I almost feel like a lot of pharmacists that are carving out new paths these days. Are having to sort of experiment a little bit. So
Mm-hmm.
I think with that in mind, I can probably just detail what I've done. I went the sort of the typical community pharmacy route, mostly as a pharmacy manager in community pharmacy. For the vast majority of my career, I did some additional schooling on the side part-time while I was working, just to sort of feed my curiosities and open up options in the future. I suppose at a certain point, I felt, I didn't feel I had to complete my rotations for my PharmD, which I was doing part-time. And I had to make the tough decision to step down from my role at the time as a pharmacy manager, because I needed to complete the requirement, and I didn't want to let that go by the wayside. And so I ended up doing that. I did some interesting rotations. One of the things that I ended up doing a little bit of work on was doing some analysis of pharmacogenetics, which I knew for a little while was, one of the major emerging themes in pharmacy practice, which would sort of take on additional sort of attention, I think, in the future. So I kind of wanted to align myself with some of these newer areas, cannabis as well, of course.
Mm-hmm.
So with that, I did some work in that area, and I started sort of using LinkedIn to engage some individuals in the industry. And I suppose, long story short, I ended up joining a young Canadian pharmacogenetic company called Inagene, because we're just kind of aligned in our vision of the future. And, taking with me was the belief that pharmacists need to be really helping to drive pharmacogenetics going forward. So there was a lot of alignment there, really sort of trying to be an agent for change and increasing adoption of pharmacogenetics in healthcare at large, but also with pharmacists being leaders in this field. And they've even done studies. They've even found that physicians want pharmacists to be the leads here and be a major agent in helping with the adoption of pharmacogenetics. So I suppose, long story short, that's that's my path in a nutshell.
No, thank you for sharing that. I think it takes courage for sure to do what you have done. I do not know of very many pharmacists who would step down from a managerial role to, then pursue a path less trodden, if I may say so. Because it's a comfort, right? It's comfort of having a job that you're very secured in, pays you well, and then to kind of step away from it. And I'm sure you must have had a time where it was kind of like uncertain what the future looks like, right, for you, and what is the next job or the career move looks like for you. But that takes courage to do that. And I agree with you rightly where you said, like, pharmacists we see as innovators in this time today are taking those risks and taking those chances and experimenting with, what they want to do. Now, you did mention about pharmacogenetics, and I do see you as, an expert in that area too. And I'm really hoping that we can unpack a bit about the pharmacogenomics side of it, and also truly understand, just because you're a pharmacist as well. I think who better than you to kind of share some insights in, how do you see the role evolving of, and you did mention pharmacists to take lead in this area of pharmacogenomics. How do you see that role of a pharmacist evolving, and what can pharmacists do within the field of pharmacogenomics that you can share?
Yeah, absolutely. I mean, just going down to the underlying pharmacological basis of pharmacogenetics, it's really just part and parcel with what our training and understanding is. You have pharmacodynamic genes and pharmacokinetic genes. I mean, we're familiar, and even when you look at some of the mechanisms that underlie major drug gene relationships, they immediately look familiar
Mm.
because they're very similar to drug interactions, which we're looking at constantly nonstop during the day. So there is very much a fit in terms of training and understanding that
Mm-hmm.
works well. And I think with that, you know, we are ultimately drug therapy specialists. And this is a component that has not been really recognized significantly historically. I mean, we're sort of in healthcare at large. I would think we tend to look at sort of non-genetic factors,
Mm-hmm.
environmental factors, circumstantial factors, or factors that are immediately, in our faces, though there could be genetic mechanisms underlying that are not sort of being looked at. So I
Right.
think I think that pharmacists have tremendous value to play here
Mm-hmm.
because we're able to look at this information quite quickly and easily, even if you're sort of naive to it and you start looking at it. It's really easy for us to get because of who we are and what our training looks like,
Yes.
and then to sort of layer on non-genetic factors, drug interactions, organ dysfunction, patient factors, costs, coverage, evidence-based guidelines, things like that. So to be able to integrate all this information,
Mm-hmm.
um, I think it just plays part and parcel. And as we see expanding scope occur, I think that we'll be able to even increasingly be able to harness this, because then we can do things like we'll be able to adjust doses,
Mm-hmm.
we'll be able to eventually get greater prescribing authority, as we see what's happened in Alberta with advanced prescribing authority.
Yes.
Hopefully, we'll start to see some of the dominoes fall throughout the rest of the country, and we'll see all these things. So, I think it's an important clinical decision support tool that improves outcomes, that sort of fits part and parcel with our profession, our training, and has a real eye towards the future, because we talk about precision medicine a lot,
Mm-hmm.
and but we're only inching towards that direction. And pharmacogenetics is a really key component of the precision medicine. And yeah, I just think that
Absolutely.
we have to be
No,
there.
thank
Yeah.
you. I mean, I definitely learned a couple of things right there in this brief period of time. So I'm sure we have a lot more to unpack. But the way I always envision the role of a pharmacist, especially with pharmacogenomics or any other specialty field, is really from a service-based model, right? Where it's really away from the product dispensing side, but we're really using our cognitive skills, as you rightly mentioned earlier. We're using our training, our understanding of the way medications and medicine works, with and how it interacts with the various aspects of our body. With that said, how, what are some barriers, I guess, because pharmacogenomics, especially here in Canada, it's still very new. It's not as evolved as it is in the down south in the United States. Any insights you have in terms of what are some barriers, that you may currently be seeing in terms of trying to implement this kind of a service in a community pharmacy?
Yeah, absolutely. I mean, I think that at the heart of both pharmacogenetics and a service-based cognitive model at large is the fact that we're largely anchored to the drug distribution um, model of
Yes.
pharmacy practice, of course. And I mean, it's the traditional revenue generation tool is
Mm-hmm.
dispensing, and actions, KPIs, etc.,
Yes.
tend to align with where the dollars go, despite the fact that pharmacogenetics and other clinical services can be monetized. We're fairly inert. We like to do what we've done. The business comes to us. People need medications. We just need to slap up a sign that says pharmacy, and people will just come to
Yes.
us. So, I think at one end, the fact that everything is aligned to this distribution model, and we throw all our resources to it. I think that's one major area that needs to be sort of
Mm.
gradually dismantled. I think with regards to pharmacogenetics, but also advanced scope pharmacy practice at large, as we continue to advance as a profession.
Mm-hmm.
Certainly, there's awareness of what the potential is and what can do. I think the vast majority of pharmacists are know what it is, have heard of it, but haven't really gotten very deep to be able to sort of unlock the
Mm.
potential of what it can do. So awareness, I think, is another component. Um, I think the last part is probably uh, the cost angle as
Mm.
well. The fact that
Yes.
there is an out-of-pocket payment, it's not cheap, even when even when the products are
Yes.
priced quite competitively, it's still not cheap by any stretch,
Mm-hmm.
and that becomes especially poignant with certain socioeconomic strata. So
Yes.
that's a tough thing, and public payers are not covering it. Private payers, in some cases, are, but it's not super clear.
Right.
And then we take that, and then I think there's this, again, going back to pharmacy inertia, is for pharmacists to say, this is what it is, this is how much it costs, are you interested? I think we tend to dismiss anything that's expensive,
Yes.
even though there could be a receptive audience to it. There are people that, when you consider what some of these things like pharmacogenetics can do,
Mm-hmm.
the value can provide can, in many cases, vastly provide, this return that outweighs the initial upfront cost. We just don't like doing it. If
It's
you
uncomfortable.
right, like uh yeah, this lidocaine 5% could help you for what you're dealing with, but the tube is $30, so I don't think you're going to want it. We do
Yes.
that right from the, like, I've done that. We kind of go in, um sort of defeating things right from the start. We're afraid of selling, and
Mm-hmm.
we're afraid of big numbers. I mean, it comes from a good place because we don't
Yes.
want to burden patients, but it's not a dichotomy. It's too expensive, you can't do it,
Yes.
or it's cheap enough and you can do it. There is, you have to consider the value it's providing.
Absolutely.
And we can't discount the fact that there's a lot of people that could derive value from these things. So I
Yes.
think that's probably a big other barrier that comes to mind.
Thank you very much for sharing that, because, as somebody who's still learning the ropes around pharmacogenomics and still trying to understand that, this really helps me in terms of understanding, what the landscape looks like and what are some of the challenges. And I agree with you, as pharmacists, we are not, and I'm guilty of this myself too, where I would say, tell my patients, this is kind of expensive. Like, think about it before you actually fill this or something like that. But at the same time, in hindsight now, I reflect back and I'm like, how many times I may have dispensed a medication, which may not be the most optimal medication for a patient, but just because it was covered, I dispensed it, right? So it's kind of like, yeah, it's like, where is the ethos? And I agree with you. Like, I think one of the challenges, and this is again speaking from personal experience, is not understanding evidence behind pharmacogenomics and what exactly can it do, and not understanding how much of an impact it can have on patients, right? And this is slowly I'm learning as I'm like reading and I'm catching up on all this information. So I guess what I want to talk about is, what are some of the opportunities that we could potentially leverage with pharmacogenomics in community pharmacy, if someone were to, implement a service model where pharmacogenomics was provided as a service to patients?
Yeah, I mean, when you look at like the quote unquote addressable market for pharmacogenetics, you can actually when you actually look at genetic variants that impact drug response,
Mm-hmm.
it's nearly everyone in the population.
Mm.
Everyone has at least once. I mean, this is assuming somebody will need a medication in their lifetime, but the potential exists, and certainly over time, we'll find new variants, we'll find new gene drug links that can implicate themselves in this process. So
Right.
at the outset, we have a large potential sort of range of applicability, which is nearly everyone.
Mm-hmm.
Um, and so there is this notion of retrospective or sort of as needed testing versus prospective testing. So prospective testing, because any sort of test of this nature will have a lag. It does take a
Right.
little bit of time to get the sample. I mean, it can be a week, but that can be significant in urgent scenarios. And so having that data right off the bat, because your
Mm.
genes don't change over life,
Yes.
is there's something to be said for having that information within, at your fingertips, depending on just depending on the scenario. Oh, to be able to influence decision making right at the start. And then, I mean, there are many cases where individuals have a non-acute but significant medical condition, and they approach it, and then you can wait a week, or you can wait
Mm-hmm.
a little bit of time where you can get the results and then speak to your healthcare provider to be able to use that information to influence decision making. So, I mean, there are sort of different ways in which this can be used, all to highlight the fact that it does have broad applicability, and there are advantages of doing it prospectively. So, I've done a little bit of work sort of trying to help pharmacists use ways to screen patients.
Mm.
Pharmacogenetics has really significant coverage in mental health. And when I say
Yes.
coverage, I mean that there's significant study and drug gene links that have been established with psychotropic
Mm.
drugs. So essentially, if somebody's being treated for, in particular, depression or anxiety, if you're seeing them going through multiple drug trials, or they're using too many benzos despite the fact that they have an SSRI, or they're using too many benzos, or they're late in refilling, their sertraline or their fluoxetine, things like that.
Yes.
Or they're just complaining to you about a side effect, or
Mm-hmm.
something's not working. There are all sorts of places in which you can actually you can insert this type of intervention to help select treatment. So mental health is a big area. Pain
Mm.
is another major area. Particularly, I mean, of course, there is overlap with some of the medications used, but there's also a lot of anti-seizure drugs, NSAIDs, et cetera, that are implicated, that have strong drug gene data. And of course, these chronic pain and mental health do have significant interplay and overlap, because if chronic pain and you're on disability, you're
Right.
probably going to get depressed at a certain point, et cetera. So, and the same thing there. Like, if you're seeing an individual's constantly asking for early refills if they're opioids, or they're just using a large morphine equivalent per day
Mm-hmm.
beyond beyond what we consider safe in terms of risks like respiratory depression, there's all sorts of clues we can see, or they're taking pregabalin, or they're using too much or too little of it than prescribed. There's all sorts of things. So it's just they can easily fit into the course of the day, the course of usual practice, because we're looking at things like adherence. We're talking to our patients about their side effects. We know their struggles, and like we have in terms of healthcare, comparatively across professions, the surface area of pharmacy towards patients is highest.
Mm,
So patients interact with pharmacies more than any other healthcare provider. This could be
right.
very transactional because they're just picking up a refill. It's stable chronic therapy. You don't need to speak to, they don't need to speak to them, at least it's not explicit that a discussion has to be had, but there are these there's these service area, there's these opportunities that exist constantly for this kind of thing to insert itself.
Hmm.
But it
Absolutely.
goes beyond that. There's other major therapeutic areas as well that it can be very helpful in.
Thank you, Ashwin, for sharing that. I definitely think you have presented some really solid use case scenarios, especially like, in terms of early implementation and early uptake. Because I think we all know the challenges we have, especially in managing mental health conditions like depression, anxiety, and like we know that success rates can sometimes be so low because, just we do not know what the genetic makeup is of that patient that we are treating, and we're trying to literally throw a dart in the dark, right? We are like trying to
Yeah,
literally hit a bullseye, but like we don't have anything to gauge like whether it's going to hit it or not. So I think this is fantastic, and I think I couldn't help but also ask you this question. It's like, can you tell us a little bit more about how can Inagene support these pharmacies, or what kind of services does Inagene provide, just so that our audience, if they want to look into it or connect with you, they would know what to
yeah,
expect.
yeah, absolutely. So we have a consignment model essentially. So we ship kits to partner pharmacies that want to partner with us.
Hmm.
There is no upfront cost once the test is sold to the patient registered. Then there's an invoice that
Right.
gets sent at the end of the month. But sort of there is a professional fee built in to the suggested price that we usually indicate. So there
Okay.
is a professional fee built into the cost of the test for you to be able to take the results, interpret them, and apply them to the clinical scenario, the chief complaint of your patient, and that can be then used to inform decision making, pharmaceutical or clinical opinions, um, or basically sort of different types of therapeutic interventions.
Mm.
So that we do partner with a number of pharmacies, and like we really want to see it succeed. So like I'm here, like you email me, you want to chat about your patient, how to interpret this, because it's it could be your first time, it could be your
Right.
50th time. You just need a little bit of guidance.
Hmm.
I'm here. You just let me know and make time, because we really want to succeed. And just selfishly, divorcing me from my sort of my full-time day job. So I want pharmacists to win. Like I
Yes.
want pharmacists to win in healthcare, and I want pharmacists to win with regards to advanced practice, start sort of divorcing ourselves from this distribution role that we're clinging on to. And I just want to see pharmacists win, and I want to help you get to that level. And if it means that you do pharmacogenetics, and then you also do a travel health clinic, like
Yes.
I want to see you win on all those fronts, and pharmacogenetics is a big part of that. But there's all sorts of other areas as well. So maybe this can help to sort of ignite exploring additional offerings, to create a really, really robust slate of services that can help to change your business model a little bit, so that you're less reliant on dispensing. Because, like, I mean, markups are just going to keep being slashed
Hmm.
in terms of payers, and dispensing fees are static, and there's in the long run this is just becoming less and less viable.
Agreed.
So
Thank you. Thank you. Because, and I agree with you 100% on that. I feel like, the dispensing model, or our current model, the way we practice pharmacy, especially in a community setting, it is something we need to be a little bit cautious about as, we look to the future. With
Yeah.
current economic times, with the predictions for next year and the years after, we do not know what that's going to look like. We do not know if we rely on public funding to kind of support our dispensing. That's a real, sword that's dangling on our neck, if I may say so. But at the
Yeah,
same time, you are a numbers guy. I know you have done your MBA, so like this is a perfect question. Pharmacist and an MBA, you give me your insights.
I
You know,
pretend. I can pretend to answer this question.
Oh, I'm sure you know the answer. And you know what? We'll take any insights because I really do think that you are very knowledgeable. I've heard you speak at conferences and I've seen your work and it was a pleasure when you said yes, I'm going to come to your podcast. I was like, yes, okay, this is great. So I
I
have to ask
appreciate
you
that.
this question. Can pharmacists have a viable future away from the dispensing focused model? Can pharmacy survive and pharmacists survive?
I think we can, but we have to work hard to get there.
Hmm.
And I think a lot of it is, a lot of it is inward, a lot of it is outward as well, but there is this inward growth that we need to sort of embrace a mindset change that, you know what, we've got to own, I've got to own this specialization that we have, which is in pharmacotherapy.
Mm-hmm.
We get the most training, we have the most knowledge with regards to drug use. And this can be in treatment options, this can be in determining adverse reactions, serious to minor, to major drug interactions, um, to there's so many areas that drug therapy knowledge can have a major impact. So we really need to be a part and parcel with interpreting that knowledge in patient scenarios and providing value. Because every time there's some sort of study that's done looking at pharmacists' expanded scope in different therapeutic areas, every single time, at least every single one that I've looked at, the outcomes are always better,
Mm.
and it provides provides better cost effectiveness compared to sort of incumbent options that exist. So, I think we really just need to embrace that, and we need to sort of get away from this inertia, and we have to get away from being self-defeatist. Hey,
Mm-hmm.
look, I'm guilty of it too. So I'm
Yes.
saying this to myself as much as I'm saying it to others, and it's easier said than done. It's hard.
Yes.
It's hard, but I think certainly it's there because you know what, there drug medication therapy is still a massive component
Yes.
of medical care, and we need stewards, we need experts driving that. And look, we have other professions that are highly competent, provide tremendous value, and they are implicated within medications. But I think that pharmacists can actually get us to the next level. We can
Yes.
take that level of care to the next level, because every time we are offered this option and we embrace it fully, it always happens.
Exactly.
Um, but yeah, I think it does need some thoughtful changes, introspective and structural changes to help us get there. And that's not something that we can dismiss quickly. It's going to take a bit of time.
Absolutely. But no, I'm very optimistic about the way you have answered that question because I think it's always a question a lot of pharmacists have in the back of their minds, but it's something that we've never really kind of talked about in the open. So I really appreciate that you took the time to share your insights. And again, we're being very mindful and conscious that these are your insights, but truly appreciated. And we want to make sure that this is an individual opinion only, and it should not be implicated as anything else. But that said, I do want to, take us back to your Pharmacy U conference presentation because this kind of ties in with something you had mentioned in that presentation around the image of a pharmacist evolving into that of being an authoritative pharmacotherapy specialist. That word, that term just stuck with me. And I would
Yeah.
love it if you could share a bit more in terms of that presentation, and also, if you could dive a little bit more deeper into what does that look like for you, and what is that vision of yours? What does that look like?
Yeah, it's my pleasure, and it's an area obviously I'm pretty passionate about, and I think it comes down to some maybe central themes or
Mm,
concepts. I think at the outset we have to recognize that drugs are just drugs; they're commodities. It doesn't
yes.
matter what pharmacy you go to; it's going to be the same everywhere. So there's no real differentiation. And so when you look at commodities, they tend to flow in certain ways, like
Mm,
even in like a broader macroeconomic perspective, or even if you look at if you're so inclined, if you're to look at the stock market or different exchanges, and you look at different commodities, the way prices go up and down,
hmm.
and then if you were to look at a company that mines that commodity, so this is the company that you're looking at, and you look at their stock chart, it actually flows in the exact same way.
Right.
So now think about drugs and think about pharmacies. And we
Mm,
actually flow the same way. So we're actually unfortunately bound to some of the same risks that
mm,
that these commoditized drugs have, like shortages and back orders and things like that. So much of pharmacy operations get dragged down once these happen. So many resources need to be thrown that way. So we're actually at a significant level of risk in terms of our operation of what we can do because we're so bound to this function. Now, it still is an important function, and there's much more to it than that. And pharmacists do have an important role to increasing accessibility during times like right now. But it's just sort of say at the broadest level that I think part of the issue is that because of our drug distribution function, unfortunately, we are extremely prone to the same risks
mm.
that underlie the drugs themselves. And those are business risks in one sense, which is really important for the profession because if we don't have a viable business model, our profession will really struggle. So I think that's one of the major, maybe the underlying sort of one of the underlying concepts behind what I've had the privilege of talking about. But I guess the other things in terms of the profession is there's maybe two big concepts that I really like to hammer home. And number
Hmm.
one is core competencies. So what is it that we're the absolute best at doing compared to anyone else? What are we best at doing in the background? And that goes back to our core training in pharmacotherapy, assessing and actioning drug therapy
Mm,
problems in a nutshell, monitoring treatment changes, etc. We all know this, and this is what we're best at. So we have our core competencies. And then the other part of the equation is opportunity costs.
mm.
So, what are we doing currently, and what could we actually use that time and resource to use if we were to allocate it somewhere else? And by allocating it somewhere else, could we have a greater impact?
Right.
And so this is sort of what I'm really passionate about because I think about early in my career, I was asked to do some bone density scanning.
Hmm.
So they sent a little kit to the pharmacy, and I sat in a chair a little bit outside the pharmacy, and anyone who wanted a bone density scan, I could do that. And so I'm doing general preventative screening, which of course has a role. It's important. But
Yes.
this is not what I was trained to do. I'm a healthcare professional. This is healthcare, but this is not the healthcare that I'm specialized to
Yes.
provide. And by doing this, I'm actually taking away time I could be spending actioning a major drug therapy problem.
Hmm.
And how much time do we have in the day to do this? We get so busy that we wish we could spend more time with patients doing this kind of thing. So why should I be doing bone density scans for something that, I just learned how to do in the little manual that they sent me to maybe say, hey, you might be osteopenic. Go to your doctor and get a proper bone scan done,
Yes.
or actually doing the things that I can provide demonstrable deep value doing. So that's the opportunity cost is the core competency. So I think this is kind of these concepts are sort of the North Star of how we should operate as a profession. And it's not going to be easy. There's lots of incentivization that needs to be changed. There's lots of
Yes.
things that we need to probably deprogram a little bit. But I think moving forward, we need to really think about these core concepts. At
Mm,
least the way I see it, I think we really need to think about these core concepts to sort of help to mold a future for the profession that's both better for the health system and patient outcomes, but also better for us because now we're doing what we want to do. We're doing what we love,
right.
which is providing drug therapy management services. So at least that's what I love doing.
Agreed, agreed. And you did hit on quite a few prominent points over there, with explaining that, and you've definitely given me thought, some things to think about for sure. As we move ahead and how we advocate even for ourselves and for our profession. You did allude to a little bit, but what supports do you see would need to bring this vision to life, in a community pharmacy practice? Like, what do you think would be some pieces that we currently do not have that would need to have implemented?
Yeah, and I think actually there are two major pieces that are do exist, and
Mm,
a few do sort of undertake them, but I would argue for broader adoption, which is number one, automation. Like we
mm,
need to get dispensing machines in our pharmacies ASAP.
yes,
And they're expensive. It is a large expense. There are financing options available. Um, um, but I think we really need to embrace that, number one, because yeah. Anyways, I think we need to do that, and then I think the other thing is registered pharmacy technicians. We need to
yes,
get them more deeply involved because they're better at checking prescriptions than we are, and it frees up our time to do again what we're best trained to be able to do. Didn't
exactly.
do all the schooling we did to do, to only be focused on technical checks. If you give
Mm,
somebody this task that they own and they're specialized in, and they are, tasked with this specifically, they do a better job. And they've done studies to this. So they've actually done studies with automation and registered text discreetly and found that error rates go down, staffing is easier, stockouts
uh,
are controlled better. So, you see all these advantages. And so the central theme with these two sort of innovations, I would say, are that they liberate pharmacist time from the drug distribution behemoth, I would say, not behemoth, but maybe juggernaut, I suppose, that dictates so much of what we do. So I think those are
absolutely.
two big areas.
Thank you. Thank you for sharing that. And I agree with you. I feel like the more I think about what does the future of pharmacy look like, and then that's kind of what it looks like to my eyes. But I would love to, if you were to, let's say, put it all together. I know you've kind of alluded to it in various parts of our conversation, but what does the future pharmacist in practice look like to you? And where does the future of pharmacy lie for you in the next 5 to 10 years?
Yeah, absolutely. Well, I think that, you know, you there will have to be some sort of transition. And I think using using automation and registered technicians will be an important part of that.
Hmm.
But I think what we'll gradually start to do is even within the layout of pharmacies is we'll sort of see more of a separation, when we see more of a sort of a patient rooms and more of a clinic like feel, and then we have the drug distribution sort of maybe sort of slightly off to the side because that's the operation, that's inside the factory. We don't need
Mm,
that to necessarily be as front facing. And even a desk with an administrative assistant sort of triaging things, professional services and things like that. I mean, that's what I'd love to see. I know a couple of pharmacies have started doing that, and even there's been a couple of cases where I think in Alberta they've opened up the pharmacist clinic
hmm.
at UBC. They have a pharmacy clinic as
Yes.
well. I know Tim out in Manitoba
Yes.
set up his non-dispensing pharmacy. So we're seeing these real innovators doing these things. So I think hopefully we'll see more of that going to the future. But I do think that part of part of what needs to happen is we need to reach a tipping point,
Mm.
because if you do volume dispensing and that's sort of your bread and butter, the returns are still okay enough right now.
Yes,
It's just going to get incrementally worse over time, gradually,
exactly.
insidiously worse. And then at a certain point, it'll be like, oh my God, what's happening here? We
The
need
ship's
to
sinking, and I
act.
have no time to get out.
Exactly. So I think we do need to see more of this tipping point. I mean, it's certainly it's an oversimplification. I think
Mm,
that there's also going to be factors like you know um, uh, regulators and provinces
of course.
sort of creating allowances and increasing expanding scope
Hmm.
for pharmacists to be able to do these things. But and of course, there's also the question of remuneration and getting fair terms, fair remuneration for the acts that we do provide. But
Absolutely.
yeah, I think that that's what I'd like to see us head towards, and I think we can get there. But I think there will be a little bit of pain for that,
Mm.
unfortunately.
Well, I am optimistic about the future you have painted for us, that's for sure. And I really do feel like, you hit the nail in the head right there with pharmacists tapping into their specialty. Because right now, a lot of functions we do are not necessarily our specialty. They're not necessarily what we were trained to do, or not necessarily in line with what we should be doing. But at the same time, it's kind of like those growing pains, right? It's like for us to reach from A to B, we gotta kind of go up and down, up and down, up and down,
Yeah.
and then hopefully we'll reach our point that we want to. But thank you very much, Ashwin. And I think before I let you leave, I would love it if you could, just as parting advice for anyone who's looking to do something non-traditional, or trying to, break out of a mold and trying to do something experimental. Any advice you would have given the old Ashwin as he was trying to figure out what do I do next and where do I go in my career and path, that you wish you had, but that you can share with our audience?
I would just say look where others aren't looking,
Mm,
do things that others aren't doing, particularly when there is a reward on the other side, and particularly when the risks are fairly low. So like
yes.
it's an asymmetric bet. So for example, networking, it doesn't take anything to just say, hey, to talk to somebody, you learn nuance in terms of how to approach individuals over time. And
Yes.
there's ways that work better than others, certainly. And a lot of that actually goes back to just demonstrating your value and helping people before you ask for something from them.
Mm-hmm.
But I think that there's that just really, even like LinkedIn is just a sort of an underused platform. There's a lot of individuals that are on there, but not many are actually using it to their full potential. So I think that's a major area, but it's really just, yeah, it's just being curious, look for things that maybe other people aren't looking at, and explore ideas, because oftentimes these are really, you have very limited downside for doing these things,
Mm-hmm.
and there's high upside.
Yes.
So your likelihood of success for each one of these sort of micro actions might be low, but when you stack them up, I mean, we look at a normalized distribution curve, things actually, that's when you start to see the opportunities arise.
Yes.
And it's like, there's this concept, there's this gentleman by the name of Sahil Bloom. He's a former venture capitalist
Mm.
out of the US, and explores different curiosities and talks about your luck surface area.
Ah,
So oh, you ask somebody that's in a really cool position or feeling cool, and they're like, oh yeah, I just happened to be at this spot at this time and ran into this person.
yes.
So that's at the outset, that's luck, right? But
Yes.
what are you doing to increase those chance opportunities? It's getting out there, getting out in situations, talking to people,
Right.
and being visible. So you have to kind of increase your surface area towards those chance opportunities if you're really curious and interested in maybe doing something a little bit different. And like pharmacy, we have a few different defined career paths. We have we have, we have still a lot of potential to do a lot of new and different things, especially with digital health and innovative areas.
Mm-hmm.
Um, um, but it's not a well-trod path yet. So we need to find ways, if you're really interested in doing some of these atypical things, you need to kind of look elsewhere. You have to look elsewhere from, a listserv or a job board or things like that, because these aren't well entrenched opportunities in our system yet. So you kind of have to kind of go where others aren't, I suppose, which is sort of maybe a central theme of what I
Thank
talked
you
about.
very much. Thank you. No, I resonate with that so much because, if I reflect back on my own journey, like it has kind of, exactly what that happened, right? It's like you start talking to people and sometimes, you just never know who you run into. And there are some amazing people out there like yourself who will be happy to, kind of shed some light in the area that they are an expert in and just help you, or even connecting to people or whatever it is, right? But you got to give it a chance. You got to give it a try. You have to be the one acting on it. Like nobody else can do that for you. That's all on you to do. But thank you so much for sharing that, Ashwin, because I know like that is again, like I feel like advice, you just never know when you're going to need it. And I'm just hoping, and I'm really hopeful that I'm certain to a point as well that the advice that you just shared will be helpful to somebody for sure who's listening to this podcast. So I really appreciate you taking the time for that. And with that, I am going to thank you again for, coming on, giving me your time and having this wonderful conversation. I learned so much from this. So thank you so much. For sharing all those insights. And also, I want to remind our audience who's listening to make sure that you check out some of the links that I'm going to be putting down below to connect with Ashwin, to connect with the work that he's doing. And please reach out to him. He's an amazing person, amazing pharmacist, and I'm sure you'll enjoy just getting to know him. So with that, Ashwin, thank you very much for your time, and really I hope that we'll have you back at some point in the future as well, to kind of dig a few more insights out of you.
Thank you. You're too kind. I hope I can live up to even half of the things you said. So I appreciate you reaching out and giving me the time of day to sort of ramble on about what I've done and what I think.
No, this was fantastic. I learned so much from this conversation. So truly, truly grateful. And no, seriously, I feel like this is going to be one of those conversations that kind of just blows everyone's mind, just like it did for me, because I learned so much about pharmacogenetics today. So
Thank you so much.
awesome. Well, perfect. So with that, we'll wrap it up, and be sure to tune in for our next episode. But before you do that, make sure you please subscribe down below, just so that you get our next episode update as well. Okay, with that, signing off. Bye. And with that, we'll call it a wrap. Thank you once again for staying with us through this conversation. I hope you found this conversation just as inspiring, just as intriguing, and just as eye-opening as I did. And I hope you will join us for our next episode. Stay tuned for that. But make sure, please, please, please subscribe so that you stayed updated in terms of when we release our next episode. Until then, thank you very much, and bye-bye.